looking at total cholesterol, or you're looking at LDL cholesterol, and especially of an older population, the evidence just doesn't show that it's a negative thing. In fact, it's just the opposite. People with higher cholesterol at those older ages tend to live longer. And I talked about this in Cholesterol Clarity, by the way. One of my experts was Chris Masterjohn, who now is a PhD, Dr. Chris Masterjohn now. But when he was my expert in the book, he noted that in traditional cultures that were free from heart disease, people that were in their 60s, 70s, and 80s, the older population, they tended to have higher cholesterol. And so normal cholesterol is considered 200 milligrams per deciliter. Guess what the normal was for people in this traditional culture, eating real whole foods, lots of healthy fats, minimal carbohydrates? Guess what their normal total cholesterol was in their 60s, 70s, and 80s? Would it shock you to learn it's 300? 300. And so these people that go to see their doctor now, that are in that age range, and they start to see elevations in their cholesterol, the doctor does what? The doctor freaks out. Oh my God, you're going to have a heart attack tomorrow if you don't lower your cholesterol. And so what do? They write a prescription for a statin drug. They tell them they need to cut out their saturated fat and cholesterol in their diet. And then they obediently do it. Now what happens? They lower their cholesterol, yes. They cut out saturated fat and cholesterol, yes. But that's the wrong thing to do. That's the very point in their life when they need more cholesterol in their body. Why? Because older bodies tend to have more inflammation. And what is one of the roles that cholesterol plays in the body? An anti-inflammatory effect. Oh, did you know that? Did you just learn something? Did you know cholesterol in your body, one of its purposes is to put out the fire of inflammation in your body? And so if you're an older person, you tend to have more susceptibility to inflammation. Don't you want more of those firefighters in your body putting out the fire of inflammation? You bet you do. So don't freak out if you're over the age of 60 and you've got a high cholesterol. That's not a disease that now needs a medication that didn't exist 50 years ago. You just need to use that and be healthy by it. The unintended consequence now of lowering cholesterol levels, lowering the amount of saturated fat and cholesterol people eat, artificially lowering cholesterol levels through a statin medication, is older people start to have more susceptibility to brain health issues. Statins have been found, as well as low-fat diets, have been found to be a causal factor in Alzheimer's disease and other kind of metabolic health diseases, which Alzheimer's would be one of them, Parkinson's. You also start to have dementia set in early, susceptibility to a lot of things that just doesn't need to be there. And oh yeah, by the way, when you take away the firefighters, that fire is still in there. What's going to put out the fire? Nothing. So there's an increased risk of heart disease and diabetes and metabolic damage galore. Do you see why the authors of this paper criticizing these new guidelines out of Europe are saying, look, we need to stop trying to vilify total cholesterol and LDL cholesterol. That's the thing these older people need more than anything. That makes sense? Since then, similar findings regarding LDL-C have been presented in a Korean study of 749 dialysis patients, an Italian study that included more than 1,000 community-dwelling people, in a study of more than 2,000 American Indians, and in 2 studies from Israel, including more than 5,000 patients of healthy people, in a Spanish study involving more than 50,000 high-risk community-dwelling people, in a Slovakian study including almost 500 patients with hypertension. 5 of these studies included young and middle-aged people. Furthermore, in a British study including almost 100,000 people above the age of 80, followed for 15 years, those who had the highest total cholesterol were the ones who lived the longest, both among those on statin treatment and those without. And the moral of this story is, it's not about the cholesterol. And this is something, again, I have been trying to hammer for years with this book here. And a lot of you guys say this book changed your life because it really kind of made cholesterol easier to understand for you. But the truth is, high cholesterol is not an enemy. High cholesterol is not a disease state that needs to be dealt with. High cholesterol needs to be celebrated. And I don't know about you, but as I get older, I want high cholesterol much more so than I want lower cholesterol. And lower cholesterol comes with its problems too. You start to have brain health issues, which we talked about, the onset of dementia. You have mood disorders. You have anxiety and depression kind of kick in just because you don't have enough cholesterol in your body. So let's not take out the miracle substance in your body that's helping to manage inflammation, prevent some of these mental health decline. It just serves so many good purposes. And in younger people especially, it helps to manage a lot of the hormonal pathways that are going on in your body. So cholesterol is not the enemy. A relevant question is why many previous studies of young and middle-aged people have shown that high cholesterol is a risk factor for cardiovascular disease. A likely explanation is that mental stress may be a more common phenomenon among young and middle-aged people than among senior citizens. Mental stress is able to raise your cholesterol. Did you know that? When you're under a lot of mental stress, that raises your cholesterol? Did you know that? And part of the way that works is mental stress raises inflammation in your body. And when inflammation goes higher, guess what else goes higher to try to deal with it? Cholesterol. Are you seeing why cholesterol is a good thing in your body? Are you seeing why lowering it is the antithesis of being healthy? It is. And it may cause heart disease by other mechanisms than just by raising your cholesterol. This is the thing. Cholesterol is not the reason why you get heart disease. It's not. Neither is saturated fat. The reason you get heart disease is one thing primarily: inflammation. Inflammation can be brought on by bad food in your diet, vis-a-vis refined carbohydrates and refined vegetable oils, seed oils. That's one thing. You can also get cholesterol to go, have issues with your heart because of stress and not managing that stress properly. There's so many mechanisms that would lead that to happen. And all of those things will raise your cholesterol in the interim, trying to save you. People worry about, like, I don't want to eat too much cholesterol because I'll be unhealthy. Well, guess what? The number one source of cholesterol in your body is not from what you eat. Your body is a cholesterol making machine. If you don't eat cholesterol in your diet, guess what your body does? It ups the production of cholesterol. If you eat plenty of cholesterol in your diet, guess what it does in your body? It downregulates the production of cholesterol. There is no such thing as, I got to cut back on my cholesterol so my cholesterol will go down. No, your body will just kick in the natural process to make exactly what it needs, because your body is not stupid. Your body knows that if you're under inflammation, you need cholesterol because it's the firefighter in the body. One argument that was used in these new European guidelines is based on the Mendelian randomization, which has shown that lower genetically determined LDL-C concentrations are associated with having a lower all-cause mortality, which is every cause of death. However, as pointed out by Burgess et al. In their paper, Power Linkage Disequilibrium, Pleiopatry, Canalization, and population stratification have all recognized as potential flaws in the Mendelian randomized approach. That's a long study that they put in there. That's the title of it. But according to the guidelines for the management of dyslipidemia, which is crazy high cholesterol levels, degree of coronary artery calcification, which is that CAC score. So when you get a heart scan, they're looking for the CAC score, coronary artery calcification, should be used to classify your risk for cardiovascular disease. It is correct that a CAC is a risk factor. In fact, it is by far the strongest risk factor ever measured, which begs the question, why are they so quick to do statin medication based on a high LDL-C or high total cholesterol without doing that CAC first? Because if you get a high total or high LDL-C and yet your CAC score with your heart scan comes back a big whopping 0, that high cholesterol means nothing. Have you gone to see your doctor and had a high cholesterol and he said, hey, let's do a heart calcium score before we put you on any medication? I would bet no, not likely. In the study by Cavalsi et al., for instance, the hazard ratio in men was 7.8, in women 4.8. However, they had not analyzed the association between the coronary artery calcification score and the LDL cholesterol. Data from the MESA study showed that nearly half of those individuals who would be eligible for statin medication, half of them, you guys, had a CT heart scan of 0. So they were eligible to be on a statin based on their LDL and total cholesterol, but because they had a CAC of 0, they didn't really need it. And in a study of 304 women by Hecht et al., the authors found that the association between LDL-C and coronary calcification was slightly inverse. In fact, statin treatment may increase coronary calcification. Did you catch that? If you take a statin medication, there is a study that makes the claim that it will increase actual calcification. In other words, increase heart disease. Can you see why the authors of this paper are very upset at the European guidelines trying to help people with cardiovascular disease to pay attention to LDL-C and total cholesterol as a primary risk marker? Because that leads them to take statins, and now we see those statins increasing coronary calcification. It is therefore highly unlikely that lowering LDL-C will actually lower this CAC. This is why I think we've gotten in big trouble treating numbers on a paper rather than treating disease. We should have been treating disease all along, and people, when they go to see their doctor, they think by lowering cholesterol, they are treating some disease in their body. High cholesterol is not, has not ever been, and will never be a disease. High cholesterol is not a disease. High cholesterol is a state based on things going on in the body, but high cholesterol in and of itself is not a disease. Got it? The next thing that they want to correct in this paper, high cholesterol, not a risk factor for people with type 2 diabetes. They think once you get diabetes that suddenly, oh, you got to really deal with your cholesterol. Oh my gosh. I'm going to remind you in case you've forgotten about this. Diabetes, heart disease, metabolic syndrome, PCOS, I can go down the line. All of these manifestations of disease that we classify in all these different categories, they are all the same disease of insulin resistance. Don't ever forget that. Every single one of them is insulin resistance, just manifested in different ways. And so when someone has type 2 diabetes, they don't need to deal with their high cholesterol. It is generally viewed that having a high LDL-C is a cardiovascular risk factor for people with type 2 diabetes. And according to these new European guidelines, all high-risk diabetics should immediately go on a statin medication, no questions asked. However, in a follow-up study of 31,000 people with type 1 diabetes between 2003 and 2011, LDL cholesterol was not a risk factor at all in the elderly. In a 7-year follow-up study of 313 type 2 diabetics, neither total nor LDL cholesterol was a risk factor for non-fatal or fatal coronary heart disease.